My name is Chris Granger-bell, and my project is the lateral chest. I greeted the patient upon her arrival. I asked the patient what was causing her so much trouble, and she told me that she had some difficulty that was coming from her left chest. I verified the email from the physician for lateral chest for the left lateral chest via email. Since the patient came into the examination room on a gurney, I transported the gurney to the wall bucky and elevated the anterior portion of the gurney so that the patient was sitting upright. The IR that we used for this case was 14 by 17. The IR orientation was portrait. The IR location was in the wall bucky. The SID was 72 inches. The patient position was sitting on the gurney. The part position was the left lateral chest. The CR location was 72 inches away from the wall bucky. There was no need for any angulation of the tube for this examination. The collimated field size was from C7 to T10. The marker was located on the top right of the image receptor. The KVP range for this patient was 120. The instructions to the patient was for the patient to take a deep breath in and then exhale, and then once again to inhale and to hold her breath until the exposure was complete. The anatomy demonstrated was the entire lung from the apices to the claustrophoretic angles and from the sternum anteriorly to the posterior ribs and the thorax posterior. The items in profile are the entire lungs from the apices to the claustrophoretic angles. The pathology best described is the retrosternal and retrocardial air spaces, as well as any fractures to the ribs that are in view.